So I've had several more patients who are expecting mothers in my office recently, and I gotta say I'm really excited about it. So I wanted to step and do a quick informational video about how chiropractic helps during pregnancy. So as you know, when a baby is growing in the womb, it's very important how that baby is positioned. And so your baby has to get positioned to like a head down position, and it has to be turned the right way and everything for an optimal labor and delivery process. So this is where chiropractic can come into play. And I actually have my spine here to kind of help me out. So here is a spine, like a pelvis specifically, so I'll kind of stand up. So this is how you're looking at me now. Pelvis kind of lined up here, low back, middle back, neck, and your skull. So looking at you from the side. So anyways, you will basically, when you are pregnant, this pelvis needs to open up and make room for the baby. And the way chiropractors address this is through some very gentle sort of massage type techniques, you might think of them as, and also some adjustments of the pelvis. Your pelvis is all held together with ligaments. So ligaments are not supposed to move very much. They're supposed to be pretty taut or tight, and muscles are supposed to contract and relax. Those are the really movie, roundy things, for lack of a better word. But what happens when you are pregnant is your body secretes a lot of the hormone relaxin, and this causes your ligaments to purposely relax more. So kind of like an old tube sock that gets stretched out, or a hair tie that isn't as tight anymore. A couple examples of things that kind of just get stretched out. This is happening in the body so that your pelvis can open up, relax, and allow for optimal positioning of the baby. So if you've got a baby that's curled up in the womb, it needs to turn head down, it needs to be a certain way, it needs to rotate. It's got to be like essentially a little bit of an internal gymnast. So in order to do that, the chiropractor that you go to, I specifically have a table that props the pelvis up and lets the belly hang down really gently. So I'll even do an example of an adjustment in a video sometime to help you see. But the belly can just hang down. You can lay on your, well, face down, kind of on your stomach. Your stomach's supported but hanging freely. And then you just basically do some contacts to the different ligaments of the pelvis. So as you are laying face down, some of the pelvis ligaments that are attaching different bones, you just release and relax those. And it feels, like I said, a little bit like a glorified massage. The techniques that chiropractors use are Logan Basic technique and a lot of the Webster technique as well, which works on the round ligaments which support the uterus. So with some relaxation, ideally the pelvis gets into this nice and relaxed, opened up place, and along with the help of your hormones, then regular adjustments can even help babies to naturally turn that are breached. It is not too late, even if you have a day or two left. Getting a chiropractic adjustment is a great way to ensure that you'll have a happier, healthier delivery and labor process. And it can also just help for the mom to relax, to heal better after everything. So basically those are just a couple of ways that chiropractic can really help. Not to mention just sciatica, back pain, GI issues like reflux, constipation, diarrhea. All those kind of things can just be helped by regular care of your spine. So don't wait, get into your chiropractor to get checked, and then when that baby arrives, there are even some really gentle techniques you can use on the infant itself with your pinky finger, and you only use about the tension you would use on your own eyelid. So it's a very gentle technique. Your whole family is going to be happy, healthy, and all natural. So if you have any questions, shoot us a message and be happy to see if you'd be a good fit for getting chiropractic care while pregnant. Have a great day.